If you need a hip replacement, there is new technique that should make your recovery less painful and much shorter. Dr. Kurtis Staples from Sonoran Hip Center, along with his patient, Jim Pluger, they are here to tell us about this new approach. Good to see both of you. Technology that so many people right now are saying, yes, finally. So tell me, doctor, if you will, where is the place that most patients will feel pain if they're suffering from hip?
Surprisingly, most people feel pain actually in their groin if they have a problem with their hip that may lead to a hip replacement.
And so how does the patient know if they need a hip replacement?
So a lot of times they feel like they may have a muscle pull or something like this, and they'll go to their doctor. And really the idea is to get an x-ray to look at the hip, and that helps us understand better what's going on in the joint. Oftentimes they feel like they've pulled a muscle, but in fact that really can represent arthritis of the hip.
Right, and over time, Jim, I know this is what was affecting you. You're an active guy, you know, you're in your early 60s, you play golf, you do all those wonderful things. When did you know, you know what, this hip is giving me too much trouble, I need to get it fixed?
I think about 3 years I started feeling this little bit of a sting in my groin area, and then it got progressively worse as I ran and just worked out. It just got worse and worse, and pretty soon I had a pretty aggressive limp. So I knew something was up.
And then you said, I need to give Dr. Staples a call.
I need to see this man.
Yeah, and this is video of you playing some golf. And so your lifestyle was being affected.
Oh, spot on. Athletically, I was not performing like I was, and also my golf game was really starting to deteriorate. And I went, I've got to change this.
Yeah, we can't have that. We cannot have that. So for Jim, it was the right time. He came to see you, and give us an idea of when it's the right time for hip replacement.
So the right time is when you really feel limited in your activities, or when the things that you enjoy doing you can no longer do regularly. When you have trouble getting your socks and shoes on in the morning, or getting in and out of your car. Those are times when it's starting to affect your life and your daily activities, and that's when it's time to look at it.
And this new technology, cutting edge, tell us about it.
So anterior hip surgery is the best way for this to happen, and it's a new way that we can do the surgery without damaging any of the muscles or tendons around the hip, and that allows for a faster recovery with less pain.
And that's what you had, Jim, correct?
Exactly.
And how quickly were you back on your feet?
2 hours after the surgery, in order to walk out in outpatient, I had to go to the washroom, so I walked to the washroom, and then subsequently 4 days later I was back in the gym.
So not 2 days, not 2 weeks, 2 hours.
2 hours.
How do you feel today?
Perfect. I feel better than I have since I was in my early 40s.
Oh my goodness. Are these the kind of results that you're seeing with this new technology? Because the old technology was much more invasive.
It was, and it took much longer to recover. And Jim is really a poster of success here. But it really can be that quick of a recovery, and that's important for patients today.
What's the typical recovery for hip replacement?
Most patients are walking the same day. Most patients go home the next day or the same day like Jim did, and within a few short weeks are back to their normal activities.
And because of this new technology, I can imagine the recovery time is so much faster, and then that kind of helps too, because then you can start exercising and doing all those things again.
Absolutely. Well, and you get back to your life much quicker.
And you got your life back.
I sure did.
Oh, and your smile is perfect.
I enjoy it.
Well, thank you both. Great information. And the Sonoran Hip Center, they have 3 Valley locations. If you would like to book an appointment, the number is there on your screen, 480-874-2040, or visit their website, sonoranhipcenter.com.